You're listening to the Hoof Care Companion, the podcast dedicated to the science, art and practicalities of keeping horses sound from the ground up. I'm your host, Marc Jerram, and each episode will take a deep dive into the world of hoof anatomy, pathology, care and rehabilitation. Whether you're a farrier, veterinarian, therapist or simply passionate about horse health, this is your space to learn, question and grow. We'll explore the latest research, time-tested methods and real-world case studies to help you better understand the structures beneath the hoof capsule and how to support them when things go wrong. Because good hoof care isn't just about trimming and shoeing, it's about understanding the whole horse. So let's get stuck into today's topic. Episode 20, an overview of navicular syndrome.
Introduction.
Navicular syndrome remains one of the most significant causes of chronic forelimb lameness in horses throughout the world. The condition has historically been associated with degeneration of the navicular bone itself. Although modern understanding recognises that navicular syndrome is not a single disease entity, but rather a complex group of pathological changes involving the navicular apparatus. These structures include the navicular bone, deep digital flexor tendon, navicular bursa, collateral sesamoidean ligaments, distal impar ligament and surrounding soft tissues within the palmar region of the foot. The syndrome is particularly important within farriery because hoof balance, foot conformation and biomechanical loading all have a profound influence upon the development, progression and management of the disease. Navicular syndrome most commonly affects mature horses used for athletic disciplines such as show jumping, dressage, eventing, hunting and pleasure riding. Warm bloods, quarter horses and thoroughbreds appear predisposed, although the condition may occur in any breed. Horses with upright feet, small feet, relative to body size, long toes and underrun heels are frequently associated with the disorder. Chronic pain originating from the navicular region can severely compromise performance, welfare and long-term soundness. Successful management requires close collaboration between veterinary surgeons, farriers, physiotherapists, nutritionists and owners. Modern imaging techniques have transformed the understanding of navicular syndrome. Historically, the condition was diagnosed primarily through radiographic changes within the navicular bone itself. It is now understood that many horses exhibit severe lameness with minimal radiographic change, while others possess significant radiographic abnormalities without clinical signs. Magnetic resonance imaging has demonstrated that pathology affecting the deep digital flexor tendon and navicular bursa often plays a major role in pain generation. The farrier occupies a critical position in both prevention and management. Appropriate trimming and shoeing techniques can reduce mechanical stress upon the navicular apparatus, improve breakover, redistribute weight, bearing forces and enhance comfort. Poor farriery may accelerate degeneration through excessive heel collapse, delayed breakover and abnormal loading patterns.
Anatomy of the navicular bone and navicular apparatus.
The navicular bone, also known as the distal sesamoid bone, is a small canoe-shaped bone located within the palmar aspect of the distal interphalangeal joint. It lies between the middle phalanx and distal phalanx at the rear of the foot and functions as a fulcrum over which the deep digital flexor tendon passes before inserting upon the solar surface of the distal phalanx. The navicular bone possesses several distinct anatomical surfaces. The flexor surface lies adjacent to the deep digital flexor tendon and is covered by fibrocartilage to reduce friction during movement. The articular surface faces dorsally and articulates with the distal interphalangeal joint. The proximal and distal borders provide attachment sites for important ligaments. Numerous vascular channels penetrate the bone and are visible radiographically. Alterations in these vascular channels have traditionally been associated with navicular disease. The navicular bone is suspended within the hoof capsule by a series of ligaments. The collateral sesamoidean ligaments attach proximally from the middle phalanx to the navicular bone and provide stability. Distally, the distal impar ligament anchors the navicular bone to the distal phalanx. These ligaments play a major role in supporting the bone during locomotion. The deep digital flexor tendon passes over the flexor surface of the navicular bone before inserting onto the distal phalanx. Between the tendon and bone lies the navicular bursa, a fluid-filled synovial structure which minimises friction. Damage to the tendon or inflammation of the bursa commonly contributes to navicular syndrome. The hoof capsule itself profoundly influences the biomechanics of the navicular apparatus. During weight bearing, the heels expand and the frog compresses against the ground, dissipating concussion and assisting blood circulation. Long toes and collapsed heels increase tension upon the deep digital flexor tendon and therefore elevate pressure against the navicular bone. Poor hoof conformation can consequently create chronic biomechanical stress within the navicular region. Blood supply to the navicular bone is relatively limited compared with other skeletal structures. Compromised circulation may contribute to degenerative change. Repetitive compression, inflammation, and vascular disturbance may ultimately lead to bone remodeling, fibrocartilage degeneration, and soft tissue injury.
Signs of navicular syndrome.
Clinical signs of navicular syndrome vary considerably depending upon the severity and structures involved. The condition usually presents as a chronic progressive forelimb lameness, which may initially appear intermittent. Horses often exhibit bilateral forelimb involvement, resulting in a short choppy gait rather than an obvious unilateral lameness. Affected horses frequently stumble during exercise, particularly upon hard ground. Riders commonly report reduced stride length, reluctance to work forwards, and poor performance during turning movements. Horses may resist landing heel first and instead adopt a toe first landing pattern to minimise pain within the palm of foot. This altered gait significantly influences hoof wear and muscular development over time. One characteristic sign involves shifting weight between forelimbs while standing. Horses may alternately point one foot forward to relieve pressure upon the heels. Hoof testers applied across the frog and heel region often elicit pain responses, although this is not always consistent. Lameness may worsen upon hard surfaces and improve on softer footing. Circling the horse on a firm surface frequently exaggerates the lameness, particularly when the affected limb lies on the inside of the circle. Flexion tests involving the distal limb may intensify discomfort. As the disease progresses, secondary muscular asymmetry may develop through chronic compensation. Shoulder musculature may become uneven and horses can develop shortened cranial phase limb movement. Chronic pain often affects behaviour and temperament, producing irritability during work or hoof handling. Hoof conformation changes are commonly observed. Horses may exhibit contracted heels, narrow frogs, long toes and underrun heels. The hoof capsule may become asymmetrical due to uneven loading patterns. Growth rings may reflect altered weight bearing and chronic stress.
Causes of navicular syndrome.
Navicular syndrome possesses a multifactorial etiology involving hereditary, conformational, biomechanical and environmental influences. No single cause explains every case, and the syndrome likely develops through cumulative stress acting upon susceptible structures over time. Conformation plays a major role. Horses with upright pasterns and feet experience increased concussion because shock absorption through the limb becomes reduced. Conversely, horses with excessively long toes and low heels develop greater tension within the deep digital flexor tendon. This increases compressive forces against the navicular bone during locomotion. Poor hoof balance is strongly associated with navicular pathology. Delayed breakover resulting from long toes increases strain upon the navicular apparatus during the stance phase of movement. Underrun heels reduce support beneath the caudal foot and contribute to heel pain and collapse. Genetic predisposition may influence susceptibility. Certain bloodlines within warm bloods and quarter horses appear more commonly affected. Inherited conformational defects such as small feet relative to body mass may increase risk. Excessive work upon hard surfaces contributes significantly. Repetitive concussion damages fibrocartilage, ligaments and bone. Horses involved in jumping disciplines may experience substantial forces through the navicular region during landing. Improper shoeing can accelerate degeneration. Shoes placed excessively forward delay, breakover and increased lever forces. Raised clenches, imbalanced feet and prolonged shoeing intervals may all contribute to abnormal biomechanics. Obesity and excess body weight increase mechanical loading upon the feet. Nutritional imbalance may indirectly influence hoof quality, inflammatory status and metabolic health. Horses suffering from poor hoof horn integrity may develop inadequate shock absorption. Age-related degeneration also contributes. Repeated microtrauma over many years may ultimately overwhelm the capacity for tissue repair, leading to chronic inflammation and structural damage.
Pathogenesis of navicular syndrome.
The pathogenesis of navicular syndrome involves progressive degeneration of structures within the navicular apparatus, resulting from chronic biomechanical stress and inflammation. Modern understanding recognises that pathology rarely affects only the navicular bone itself. Abnormal hoof mechanics increase tension within the deep digital flexor tendon during breakover. As the tendon passes over the flexor surface of the navicular bone, compressive pressure develops between these structures. Repetitive loading damages fibrocartilage upon the flexor surface and promotes inflammation within the navicular bursa. Micro damage to the deep digital flexor tendon commonly develops near the level of the navicular bone. Tendon fibers may tear or degenerate through chronic friction and compression. Inflammation within the navicular bursa further exacerbates pain and tissue injury. Altered blood flow may contribute significantly. Compression of vessels supplying the navicular bone can impair circulation and promote bone remodeling. Historically, vascular compromise formed a central theory of navicular disease development. Although modern evidence suggests vascular pathology is not the sole cause, impaired perfusion likely contributes to degeneration. Bone remodeling occurs in response to chronic stress. Radiographic changes may include enlargement of vascular channels, medullary sclerosis, cyst-like lesions and flexor cortical erosions. These changes reflect attempts at adaptation and repair. Pain originating from the navicular region causes altered gait mechanics. Horses attempt to unload painful structures by landing toe first. This further disrupts normal hoof function and increases stress upon the dorsal hoof wall and deep digital flexor tendon. A cycle of compensation and degeneration consequently develops. Secondary hoof capsule distortion often follows chronic pain. Reduced frog loading leads to atrophy, contracted heels and diminished digital cushion function. Loss of caudal hoof support worsens concussion and perpetuates pathology. Inflammatory mediators released during chronic tissue injury may sensitize local nerves and increase pain perception. Long-standing cases frequently involve multiple pathological processes simultaneously, making treatment challenging.
Dietary considerations.
Nutrition plays an important supportive role in horses suffering from navicular syndrome. Although diet alone cannot cure the condition, appropriate nutritional management may improve hoof quality, reduce inflammation and assist weight management. Maintaining optimal body condition is essential. Excess body weight increases loading upon the distal limbs and intensifies stress within the navicular apparatus. Obese horses may therefore experience more severe clinical signs. Controlled calorie intake combined with appropriate exercise assists weight reduction where necessary. Hoof horn quality depends upon adequate nutrition. Deficiencies in biotin, methionine, zinc and copper may compromise hoof integrity. Poor hoof quality reduces shock absorption and predisposes the horse to mechanical imbalance. Supplementation with balanced hoof support products may improve horn growth over time. Omega-3 fatty acids possess anti-inflammatory properties and may support horses suffering from chronic musculoskeletal conditions. Sources include linseed and fish-derived supplements. Reduction of excessive dietary starch and sugar may also help minimize systemic inflammation. Adequate forage intake supports gastrointestinal health and stable metabolic function. Horses prone to insulin dysregulation or metabolic syndrome require careful management, because metabolic disturbance may adversely influence hoof health and inflammation. Mineral balance is important. Excess iron within forage may interfere with copper and zinc absorption, potentially affecting hoof development. Nutritional analysis of forage and balanced supplementation can therefore prove beneficial. Hydration also influences hoof elasticity and quality. Dehydrated hoof horn becomes brittle and more susceptible to cracking. Consistent access to clean water remains essential for overall hoof health.
Veterinary diagnostics.
Accurate diagnosis of navicular syndrome requires thorough clinical examination combined with advanced diagnostic imaging. Because multiple structures within the foot may produce similar signs, comprehensive assessment is necessary. Clinical examination begins with observation of posture and gait. The veterinarian evaluates the horse at walk and trot on different surfaces and during circles. Toe first landing and shortened stride length may indicate palmar foot pain. Hoof testers are applied systematically across the foot to identify painful regions. Digital pulse quality and hoof temperature may also provide useful information. Diagnostic analgesia plays a major role. Palmar. Digital nerve blocks commonly improve lameness originating from the navicular region. However, these blocks desensitize numerous structures within the foot and therefore cannot isolate navicular pathology specifically. Radiography has historically formed the cornerstone of diagnosis. Standard projections evaluate the navicular bone for enlarged vascular channels, cortical erosions, cystic lesions, medullary sclerosis and distal border irregularities. Nevertheless, radiographic findings do not always correlate with clinical severity. Ultrasonography possesses limited usefulness within the hoof capsule due to restricted access. However, it may assist evaluation of proximal structures. Magnetic resonance imaging has revolutionized diagnosis of navicular syndrome. Magnetic resonance imaging allows detailed visualization of both bone and soft tissues within the foot. Deep digital flexor tendon lesions, navicular bursitis, ligament injuries, and bone edema can all be identified. This imaging modality provides the most comprehensive assessment available. Computed tomography may also assist evaluation of osseous structures and complex lesions. Nuclear scintigraphy can identify increased bone turnover within the navicular region. Accurate diagnosis is essential because treatment and prognosis depend heavily upon the structures involved and severity of pathology.
Veterinary treatment.
Veterinary management of navicular syndrome aims to reduce pain, minimize inflammation, and slow disease progression. Treatment plans should be tailored to the individual horse and commonly involve a combination of medical therapy, exercise modification, and corrective farriery. Non-steroidal anti-inflammatory drugs such as phenylbutazone are frequently used to reduce pain and inflammation. These medications may improve comfort and performance, but should be monitored carefully due to potential adverse effects associated with prolonged administration. Intra-articular medication of the distal interphalangeal joint or navicular bursa may provide significant relief. Corticosteroids reduce inflammation while hyaluronic acid supports joint lubrication. Injection of the navicular bursa requires considerable skill due to the close proximity of important structures. Bisphosphonate medications such as tilludronate and clodronate have become increasingly popular. These drugs influence bone metabolism and may reduce pain associated with navicular disease. Clinical response varies between horses. Regenerative therapies including platelet-rich plasma and stem cell treatments are being investigated for soft tissue lesions affecting the deep digital flexor tendon and associated structures. Controlled exercise programs are important. Complete rest may weaken supportive tissues and compromise hoof circulation, whereas excessive work worsens degeneration. Appropriate exercise on suitable footing helps maintain mobility and hoof function. Extracorporeal shockwave therapy may provide temporary pain relief through modulation of nerve activity and tissue stimulation. Some horses respond favourably, although results remain variable. Surgical intervention may occasionally be considered. Palmar digital neurectomy involves transection of the palmar digital nerves to eliminate pain sensation from the heel region. Although some horses return to athletic use following surgery, complications such as neuroma formation, unnoticed injuries and recurrence of lameness may occur. Ethical considerations surrounding neurectomy remain significant. Management of footing is also important. Deep or excessively hard surfaces may exacerbate clinical signs. Many horses benefit from consistent moderate footing, which reduces concussion and excessive strain.
Static assessment of the horse with navicular syndrome.
Static assessment forms an essential component of farriery evaluation in horses with navicular syndrome. Careful observation of posture, conformation and hoof balance provides valuable insight into biomechanical stress affecting the navicular apparatus. The horse should be examined standing square upon a level surface. Many affected horses demonstrate a tendency to point one forelimb forward in an attempt to reduce heel loading. Frequent shifting of weight between limbs may also occur. Conformation of the distal limb should be assessed carefully. Horses with upright pasterns and feet experience greater concussion, while those with long toes and underrun heels exhibit increased strain upon the deep digital flexor tendon. Mediolateral imbalance may contribute to uneven loading within the foot. Evaluation of hoof capsule symmetry is important. Contracted heels, narrow frogs and collapsed heel structures are commonly observed. Growth ring patterns may reveal uneven weight distribution or chronic mechanical stress. Heel height and toe length should be measured accurately. Excessively long toes delay breakover, while low heels reduce support beneath the caudal foot. The relationship between hoof angle and pastern angle should also be assessed. The frog and digital cushion require close examination. Atrophy of these structures reduces shock absorption and may worsen concussion within the navicular region. Sole depth and hoof wall quality also influence comfort and support. Wear patterns upon existing shoes provide valuable information regarding gait and loading characteristics. Excessive toe wear may indicate toe first landing associated with heel pain. Palpation of tendons, ligaments and hoof structures may identify pain, swelling or asymmetry. Static assessment allows the farrier to formulate a trimming and shoeing plan designed to restore balance and reduce mechanical stress.
Dynamic assessment of the horse with navicular syndrome.
Dynamic assessment evaluates a horse during movement and provides crucial information regarding gait abnormalities associated with navicular syndrome. Observation should occur upon both hard and soft surfaces at walk and trot. Affected horses commonly exhibit shortened cranial phase, limb movement and reduced stride length. Bilateral involvement may produce a stiff shuffling gait rather than obvious unilateral lameness. Landing pattern is particularly important. Healthy horses generally land heel first, allowing the frog and digital cushion to absorb concussion. Horses suffering from navicular pain frequently adopt a toe first landing pattern to avoid loading painful heel structures. This altered gait increases stress upon the dorsal hoof wall and deep digital flexor tendon. Turning movements often exacerbate lameness, particularly upon firm surfaces. The inside limb experience increased loading during circling and may display more obvious discomfort. Observation from multiple angles allows assessment of limb flight patterns, breakover and mediolateral balance. Delayed breakover may appear as prolonged toe contact with the ground. Video analysis and slow motion recording have become valuable tools within modern farriery practice. Subtle asymmetries and landing patterns can be assessed more accurately using digital technology. The farrier should also evaluate the horse under saddle where appropriate. Rider feedback regarding stumbling, resistance or loss of performance may provide additional information. Dynamic assessment helps determine the effectiveness of previous shoeing methods and guides future therapeutic interventions.
Farriery trimming and shoeing methods.
Farriery management represents one of the most important aspects of navicular syndrome treatment. Correct trimming and shoeing aim to reduce stress upon the navicular apparatus, improve breakover, enhance heel support and encourage more normal biomechanics. Trimming should prioritise restoration of hoof balance while preserving heel mass and caudal support. Excessive heel removal must be avoided because this increases tension within the deep digital flexor tendon. The toes should be shortened appropriately to improve breakover and reduce lever forces during propulsion. Raised heel shoeing has historically been widely used for navicular syndrome. Elevating the heels decreases tension within the deep digital flexor tendon and reduces pressure upon the navicular bone. Heel elevation may be achieved through wedge shoes or pads. However, excessive elevation can overload the heels, weaken structures over time, and contribute to tendon contraction. Careful moderation is therefore essential. Egg bar shoes are commonly employed because they extend ground support behind the heels and distribute weight more evenly across the caudal foot. Increased support beneath the heel region may improve comfort and reduce stress upon the navicular apparatus. Egg bar shoes also assist stabilisation of the hoof capsule. Memphis bar shoes provide frog support through a central bar extending across the frog region. By increasing load sharing through the frog and digital cushion, these shoes may improve shock absorption and reduce pressure upon painful structures. Appropriate frog contact is critical because excessive pressure may cause discomfort. Rolled toes and rockered toes are frequently incorporated into therapeutic shoeing plans. These modifications improve breakover and reduce strain upon the deep digital flexor tendon during the stance phase. Pads may provide additional support and concussion reduction. Full pads combined with impression material can distribute pressure more evenly across the solar surface. However, prolonged pad use may predispose the foot to thrush and reduce frog stimulation if poorly managed. Heel pads and wedge pads elevate the heels to reduce tendon tension. Their use should be carefully monitored because long-term reliance may weaken heel structures and alter biomechanics adversely. Aluminium shoes may reduce distal limb weight and improve ease of movement in some horses. Wide web shoes may increase ground surface area and enhance support. Barefoot management has gained increasing interest in recent years. Some horses with navicular syndrome improve when shoes are removed and hoof function restored gradually through careful trimming and rehabilitation. Barefoot management encourages frog loading, heel expansion, and improved digital cushion development. Success depends heavily upon environmental management, exercise control, and individual conformation. Hoof boots frequently play an important role within barefoot rehabilitation programs. Modern hoof boots provide protection and cushioning while allowing greater hoof mechanism than traditional shoes. Pads placed within hoof boots may enhance comfort further and encourage heel-first landing patterns. Farriery treatment should always be individualised. No single shoeing method suits every horse because pathology varies considerably between cases. Regular reassessment involving both veterinarian and farrier is essential to optimise long-term management.
Prognosis.
The prognosis for horses with navicular syndrome varies widely depending upon severity, structures involved, duration of disease and response to treatment. Early diagnosis combined with appropriate management generally improves outcome. Mild cases identified early may continue useful athletic careers with corrective farriery, veterinary treatment and workload modification. Horses with primarily biomechanical issues rather than extensive structural damage often respond favourably. Cases involving significant deep digital flexor tendon injury or advanced bone degeneration typically possess a more guarded prognosis. Chronic pain and progressive degeneration may eventually limit performance despite intensive management. Response to treatment varies considerably between individuals. Some horses remain comfortable for many years while others deteriorate rapidly. Consistent farriery, appropriate exercise and careful footing management significantly influence long-term success. Horses undergoing palmar digital neurectomy may return temporarily to athletic use, but complications can occur. Loss of sensation increases risk of unnoticed injury and recurrent lameness remains possible. Barefoot rehabilitation programs may provide excellent outcomes in selected horses, particularly when initiated before severe structural degeneration develops. However, transition periods can be prolonged and require substantial owner commitment. Overall, the prognosis should always be discussed honestly with owners. Navicular syndrome represents a chronic degenerative condition requiring lifelong management rather than definitive cure.
Conclusion.
Navicular syndrome remains one of the most complex and significant causes of chronic lameness within equine practice. Modern understanding recognises that the condition involves a spectrum of pathological changes affecting the entire navicular apparatus rather than the navicular bone alone. Degeneration of bone, tendon, ligament and synovial structures contributes to pain and altered biomechanics within the foot. Conformation, hoof balance, workload and shoeing practices all exert major influences upon disease, development and progression. Horses with long toes, underrun heels and poor caudal foot support are particularly susceptible because abnormal biomechanics increase strain upon the deep digital flexor tendon and navicular structures. Accurate diagnosis requires comprehensive clinical examination combined with advanced imaging techniques such as magnetic resonance imaging. Successful treatment depends upon close collaboration between veterinary surgeon and farrier. Therapeutic farriery aims to restore hoof balance, improve breakover and support the caudal foot while minimising stress upon painful structures. A wide range of shoeing techniques may be employed, including raised heels, egg bar shoes, Memphis bar shoes, pads and supportive barefoot rehabilitation strategies using hoof boots. No single method suits every case and treatment must be tailored to the individual horse. Although navicular syndrome often carries a guarded prognosis, many horses can remain comfortable and useful with appropriate long-term management. Continued advances in diagnostic imaging, regenerative medicine and biomechanical understanding will likely improve future outcomes for affected horses. The farrier therefore remains central to both prevention and management through the maintenance of healthy balanced functional feet capable of supporting the horse throughout its athletic life. That is it for Season 1 of the Hoof Care Companion podcast. I hope you have found the episodes useful and educational. I will be back later this year with some new topics to discuss. If you have any areas you would like me to cover, please get in touch via social media. Thank you for listening to the Hoof Care Companion. Please follow, rate and share this podcast on your social media to help the Hoof Care Companion grow and reach all of those who care for our equine friends all around the world. Visit the links in the show notes to obtain your copy of my books or to interact on my social media channels. Until next time, thank you for listening because a healthy hoof is a happy horse.